सो इसके ब्लड सप्लाई में मैंने आपको बताया, मैं आपको बताती हूँ कि ना इसका इजी डायग्राम कैसे ड्रॉ किया जाता है, बिकॉज इन एग्जाम्स वी डोंट हैव दैट मच ऑफ टाइम and we don't have to be an artist to draw a diagram in anatomy. We just have to make it concise and clear, so that the examiner should be understanding what we have drawn. They should be knowing that we know the concept, and we should be having a proper label diagram. That's it. So मैं आपको बताती हूँ कि अपने को 2 सेकेंड भी नहीं लगेंगे कि कैसे बनाना रहता है. So first we will be making the outline structure. ये उसका मिड लाइन, अगर उसको थोड़ा आपको वो देना है, थोड़ी प्रिसीशंस, यहाँ पर आएगा ब्रेस्ट. सो इसमें एक स्मॉल डायग्राम बना सकते हैं, जैसे कि हम तो आर्टरी सबसे पहले तो मीडियली देर आर दी, आई डोंट नो व्हाई इट्स नॉट वर्किंग, ओके, medially there is perforating branches of the internal thoracic artery that comes from the subclavian artery. So medially there is internal thoracic artery, perforating branches of the internal thoracic artery from the subclavian artery, and from the axillary artery we have superior thoracic, and from the acromiothoracic and the lateral thoracic artery, and from posteriorly we have on the lateral side the perforating branches of the posterior intercostal vessels. So these are the medially there is from the subclavian artery, internal thoracic artery, perforating branches, from the axillary artery, superior thoracic artery, acromiothoracic artery on the upper part, and the lateral thoracic artery, and from the posteriorly on the lateral side there is perforating branches of the posterior intercostal arteries. So this is the simplified way of the diagram for the blood supply of the breast. And the venous drainage follows the arterial drainage. Venous drainage we have two types, that is the superficial drainage and the deep drainage. Near the alveolar there is an nipple areolar complex anastomosis arteries and veins. So we have there the plexus, which consists of the superficial and deep. In the superficial part, in the veins, the superficial part drain into the internal thoracic vein. From the internal thoracic vein, this drain into the lower part of the neck. From the internal thoracic vein, this drain into the lower part of the neck. So understood about this? This is the arterial drainage, and the deeper parts goes into the axillary and the posterior intercostals. So this is the blood supply. The arterial drainage from the lateral medial side, there is the internal thoracic artery, axillary artery, superior thoracic, acromiothoracic and lateral thoracic, and the laterally to the posterior intercostal arteries. Then veins follows the arteries. Superficially they have, it goes into these internal thoracic vein. Superficial doesn't drain the nipple and areola. Deep drain the nipple and areola and the parenchyma, and goes into the axillary and the posterior intercostals. So this was all about the blood supply of the breast. Next is the nerve supply. Nerve supply is sensory and autonomous. Sensory goes to the skin and the nipple areolar complex, and autonomous goes to the circular and the longitudinal muscles and the blood vessels. It actually the that the functions of the breast does not is not regulated by the nerves. It is regulated by the hormones. And autonomous nervous system is supplied from the 4th to 6th intercostal nerves. It is supplied by the 4th to 6th intercostal nerves. So that was all about the nervous supply. Then the lymphatic drainage. Lymphatic drainage is very important in the breast because of the clinical anatomy, that is the breast cancer. First we should be understanding what are the different lymph nodes and lymphatic vessels draining the vessels. First we should be drawing our same diagram, very simplified way. This is the diagram. You can just draw this diagram in just 2 seconds. So this is the breast, nipple alveolar complex. This is the axilla. So anterior group of nodes, lateral group of nodes, posterior group of nodes, This is called as the central group of nodes. Here somewhere sorry, here somewhere is the apical group of nodes, and here is the supraclavicular nodes. So these are the different group of nodes of the axilla. These are the 5 group of nodes, very important. The major part drains into the anterior group of the lymph nodes. So there are superficial draining system and the deep draining system. Superficial draining system generally takes the nipple areolar accepts the nipple areolar complex, takes the tissues to the anterior group. So all the vessels drain into the anterior, and there is parasternal or the internal thoracic. Near the internal thoracic artery there are the lymph nodes, so draining the deeper part, and some few goes into the other parts also. The other parts naming like the posterior intercostal near the ribs head there, and also the cephalic part through the supraclavicular. Also it goes into the subdiaphragmatic plexus, also the subperitoneal plexus, which may spread the breast cancer to the abdominal region, also to the ovaries, liver. This we will be learning into the breast cancer, the clinical anatomy. So this is the lymphatic drainage of the breast. And in next part, the very important part is like, if you write this clinical anatomy in your answer, this gives a good impression of your answer to the examiner. Clinical anatomy is like what it is related to, what are the diseases, and what we know about these structures. So first and most important is the carcinoma of the breast, for which this is the most important part. The lymphatics and the lymphatic drainage is the most important part for the carcinoma of breast, because breast cancer is majorly spread through the lymphatics. So the lymphatic spread goes to the, either it may grow from the apical to the cephalic part, either it may go through the posterior lymph nodes to the vertebral bodies. It may go to the subdiaphragmatic or subperitoneal plexus. It may go to the liver mets, or the ovaries, or other part of the GIT. Then the next part is the, what are the different signs and or the clinically how we can examine and get to know there is some particular features for that carcinoma of breast. Like there may be skin puckering, that is called is the infiltration of the breast cancer cells. Then one peculiar appearance that is called as the PUD orange. The breast appears as a skin of an orange, that is called as the PUD orange appearance of the breast. It is nothing but because of the, you can remember like O for obstruction of the lymphatic system, and O for edema. It gives like an edema to the skin of the breast. So clinical anatomy, we were learning about the carcinoma of the breast and the spread through the lymphatics. It may goes to the posterior part, to the lymphatics of the vertebral bodies, or it may goes to the other part of the GI, like subdiaphragmatic, subperitoneal, or it may go to the cephalic part and spread to the other structures. How clinically we will be examining this, right, and some particular features like skin puckering. Then there is infiltration of the breast cancer cells to the lymphatics. And the PUD orange, there is the obstruction of the lymphatic structures and edema of the skin of the breast. And the other structure is the retraction of the nipple, where is a very peculiar thing for the clinically examining the carcinoma of the breast. So this was all about the clinical anatomy, or if you want to add some more clinical anatomy, you can tell about abscess drainage, which incision you should be given for draining an abscess. Then other is about the mastectomy. Mastectomy is the removal of the breast. Mastectomy means the removal of the breast. It may be either simple mastectomy or radical. You don't need to know these all things right now. And a smaller part, how will you diagnose this carcinoma of the breast? There is one thing called as the screening part. In the screening part, there is breast self examination, over which we palpate all the quadrants of the breast and examine for any lump, examine for any discharge, examine for any puckering, examine for the retraction of the nipple, or by which we can clinically get to know earlier the breast cancers. And the other part is the diagnostic, what you can say, mammogram. There is nothing but an x-ray of the chest only, that is called as the mammogram, with the lower amperes. And other thing is the FNAC, that is called as the fine needle aspiration cytology, needed for diagnosing the breast cancers. So this was all about the breast we should be knowing. So actually this is a very simple topic. You should be just knowing the concept, what is the about. First we started our answer with the breast. What is the introduction part, what is the situation, what is the extent, what is the relation to the other structures, how it is made up of to the three parts: skin, parenchyma and stroma. And the other part, how we explained what is consist of the skin, the nipple, areola, and the parenchyma, it is lobule, and the stroma, fibrous and fatty texture, and BNL, my short form, that is the blood, nerves and lymphatics. Blood supply, very simple diagram you have to draw. You make it easy and saves our times, and that easily you can understand all the structures over here also. So the different things: blood, arterial supply, venous supply, lymphatic drainage, how the different lymph nodes are arranged and how the lymphatic drainage occurs, and some few extra additional points, that is the clinical anatomy of the breast. The carcinoma of the breast is spread through the lymphatics, and the different signs we can see clinically, how we can examine it, and the different forms like diagnosis, screening, mammogram, FNAC, and also the different few small topics like abscess and mastectomy. So that's all for the breast topic. If you want to learn more, let me know what other concepts you would be liking me to make for these videos. अगर आपको ये अच्छा लगे तो आप मुझे ज़रूर बताइएगा कि मैं और कौन से वीडियोस बनाऊं कि आपको जो समझ में नहीं आ रहा हो. So that's all for today. Thank you so much, and please like and subscribe. Thank you. Bye bye.